Hi everyone, I believe by God's grace you are doing good as I am. Blessed is you, the one watching me. Begin to like, subscribe and share with at least 10 people before I give you what I have for you today. All that I have for you today is quite simple. It's all about activities in pregnant women that may affect the mental development of the unborn child, or activities in pregnant women that may result in pediatric psychiatry. So let me begin. Me kasafa enyama yeyeno say nyinsan a ebetimi ama akwara na onyam be wiase na ebeka na adwen na say oba wiase oba wiase na adwen ho atochima kakra. So the first one is drug abuse. Drug abuse, being it tobacco, alcohol, marijuana, normal drugs. As a pregnant woman there, you are not supposed to be doing self-medication or higher, then you begin to be prescribing medication for yourselves. As a pregnant woman, I won't advise you to be going to over-the-counter medical sellers say, over there, we don't do lab investigations over there. So whatever they are doing is provisional something from their brain or something from their mind, almost show no access. So then they give you something. So a provisional diagnosis not the BB or ABI suspicion or suspect say. So I won't be urging you to be going to over the counter medical service or be prescribing medication for yourself. Aside that, the use of alcohol, tobacco, being in all kinds of smoking, shisha na oshio, say jot, say weeds, say whatever. You need to stop it because it may affect the mental development of the fetus. So the child may come out. The next one is stress. As a pregnant woman, you don't need to be stressed out or stressed up. Onyema eni kwan say o ma bibi so 2 months I be ja adwendwen na say wa bra no e ma wuntimi mbo ndidi de bi adwendwen sa ase enye adwendwen so kwan na stress. Sometimes in our local societies we relate stress to tiredness, fatigue and tiredness, and I relate stress to. But then anything that cause anxiety untimi overcome maybe is a stressor. So any kind of so and then once you are pregnant, you know, so I bet difficult because you attribute pregnancy to certain and maybe always always somewhere yes. So sometimes so if something is on you and then what you need to approach a good friend or get yourself into the hospital, no more access. So aside that, exposure to toxics, there are some of us, it will be very difficult to see a battery because we are staying close to industries that these industries, their ways or their means of producing products, you know, the fumes are called atmosphere, and we can't do anything about it. But then if you are pregnant, I will urge you or I'm urging you to stay away from that thing. When your mom person can baby you produce aside that one casa of you use ladders, metal ladders. Yeah, the better should be after some time na ladder and a half fire because of friction. Or the short row at the end then we are taking them in. So I'm urging you that as a pregnant woman, you need to be using wooden spoons instead of metal ladders. Now the baby will do, and I think the wooden ones now will be better. You find no free on maternal or let me say antenatal care. Some of us they doesn't go to antenatal care. Omunko be that. Obi beba hospital so on your man. Not just any time as one the time as one actually say over and as I can just some few weeks or some few months or a month. Now this is very bad. As a lady there, the very moment I will be say menstrual cycle for the first 1 month, approaching the next month, and I say menstrual cycle. It doesn't necessarily mean a pregnancy. Say your banner so interest and never will be me ama on sebu assay and as I said the obu unsano adane kakra. So if you are a lady and I say if you are a woman, that's all may say period 1, the next 2-3 weeks and by you need to go to the hospital. Now almost access no more say a big grandpa medical condition be on its own na developing in the system. A big grandpa what fire you know that but then you other complications that pregnancy is more. The next one that I'll be talking about is infection. Most of us, we attribute or we relate infection to STIs. And I'm of course genitals infections away genitals but then infection doesn't necessarily mean gonorrhea, syphilis or something. Any microorganisms that comes into your system be infection. So being it malaria, being it typhoid, being it whatever, the herbal system it is infection. My advice for you is that as a pregnant woman, when you are diagnosed of any medical condition that comes with infection, infection and you need to get rid of it. At least or some fire draw be prescribe amount. Any cancer one can prescribe you because we have some medicines and I say some medications are once you are pregnant you can't be taking it because they are hard. It be affected the development of your child. So you don't need to be doing self medication. Get yourself inside the hospital. Assessment will be done. Then they teach you how to be even taking the medication. Some medication, you can say no pafabako, you family, obu obeka no pafaminu, you fabako. So you the one you be actually fire doing. So you need to get yourself inside the hospital. I'm saying this because of the fetus. Yeah, I be we asking the nya be we wa show me the other be Ghana onya de amayewi. But then the children are the future. So let's protect the future. Lack of social support. Sometimes when we lack social support, we become depressed. So if you are a man that you are watching me, one thing that I've been hearing a lot of ladies saying is that ladies says that a man's money tastes better as compared to them. So please support your wife, the wife or the lady that support her it all around. Baby be here support be at least try your best. Say uja or yere and as our girlfriends and as our support in some way financially and as any other social support be here being it financial or social support be here it may affect the lady or bedroom genesa and then it won't help the brain or the psychotic development of the fetus who is not even on earth. Mental has to be social violences and then natural disasters. For natural disasters, we can't stop them. Something like flooding. Flooding, the activities in the society is no anything flooding, but so we can be stopping them. But then something like earthquake and other things, we can't be stopping them. And then we are fortunate that Africa, we are not fond of seeing those things. To be precise, Ghana, but then other social vices, be to say, 2 towns be na and tokwa cities or let me say pubs now boys boom. As a pregnant woman you don't need to be involving yourself into this because you may get injured and then depending on the kind of injury or depending on the kind of substances that they will be releasing over there, it may affect the unborn child. The next one is genetic predisposing factor. That one you have nothing to do about it. Genetically, umami and papa na say ade no wo abusunim e na wabetum nti e wosa wonyem no hwe na wo no behwe wo ye wonni bibia obetimi afa because is something that is natural. So the very thing I was observing is yeah we started to take sense bi wo asum obra onipo ogina onchen na nyon na okasa other scenes nipo ogina onchen enhu bi eni kwan say wo ye too depressed far alcohol and those drugs so that the genetic factor probability that things will be pushing out will be low. Then you may be free from mental illness or your child or the fetus will be free from mental illness. Thank you for watching me. Like, subscribe and share with at least 10 people. It is Health and Sports Acumen. Bye bye.